Good day, YouTube family. Welcome back. Join me on a tour of the wellness clinic. We're going to take a quick walk through. Here is John McDonnell. He is an acupuncturist practicing holistic and Chinese medicine. And today he's going to be joining us on the channel to speak to us about acupuncture, one of the traditional ways of practicing Chinese medicine, a more holistic approach in regards to a number of illnesses that we often face as men and women. And we're taking a look here at a few of the treatment rooms. Here is one of them that displays the bed layout, the lighting, the fixtures, the setup here in the room, just to give you an idea of what things look like. I'm so excited today to have him on the channel just to speak with us and talk to us, educate us, tell us a little bit more about himself and what he does. There will be a link dropped below in the description box as a way to reach out to him in regards to any questions that you might have in regards to his video. So please help me welcome John. Here we are.
Hi, my name's John McDonnell. I'm an acupuncturist here at the Wellness Clinic in Edmonton. I've been practicing for about 8 years now, which is crazy to me. I graduated from the MacEwan University program here in the city in 2016. Like I said, I graduated from the MacEwan program, which was a 3-year program, very intensive, but I would consider it one of the better programs here in Canada for sure. So if you're someone who's considering going into the field, I definitely recommend the MacEwan program. And I was lucky enough to actually go back and teach in the program a little bit as well. Here at the clinic, I really focus not just on acupuncture, but on Chinese medicine as a whole, because not a lot of patients realize that acupuncture is just one small piece of a much larger system of medicine. So, I mean, a lot of people know that you can come in and get needles for pain relief and things like that, but I try to leave everyone with a little bit more knowledge about Chinese medicine as a whole. So that includes things from cupping and gua sha and more manual techniques to dietary medicine, living through the seasons properly, movement practices like Tai Chi and Qigong. There's a whole kind of beautiful and broad system of knowledge that is encapsulated in this medicine that's been around for millennia. So I think one of my biggest focuses as a practitioner is in that education piece. Which is why I thought that doing something like this would be a great idea, sitting down and sharing a little bit more about myself and about, the medicine as a whole. Maybe for viewers who don't know much about acupuncture, I can give a little bit of an explanation of what acupuncture is and what a treatment kind of looks like. So acupuncture is again, a system of medicine that's been around for quite a long time. It developed slowly, obviously in the modern day we use things like single-use sterile needles, and it's very kind of regulated. Obviously, thousands of years ago, they were using things like rocks and sharpened bones and things like that. And over the years, it became more and more of a sophisticated form of medicine and kind of led us to where we are today. But the idea is that the body is covered in acupuncture points. And these points essentially lie on channels called meridians. And those meridians flow on the surface of the body where we can access them with needles, but they also dive deep and connect all of our internal organs, all of our tissues, and create kind of an interconnected web. So the idea is that we can needle these spots with really fine needles and bring the body back to balance. So like I said, most people know acupuncture for pain, but given that it is a very holistic approach to the body, we can also treat things like sleep and mood and digestive issues. There's a lot of women's health issues that respond really well to acupuncture as well. So helping to regulate the menstrual cycle, helping with things like symptoms around the cycle. Fertility also is a really kind of growing side of Chinese medicine and acupuncture. So I always tell patients that the needles aren't really adding anything to your body. They're helping to trigger the natural healing reaction that's already there and kind of bringing your body back to balance by essentially reminding it how to do what it already knows how to do. So in that way, I view myself as a practitioner less as like a healer and more as like a gardener. You know, I'm helping to create the right environment and the right circumstances that your body can then use to heal. But really it is you, the patient, who's doing, you know, the heavy lifting of healing and moving through into a place of disharmony to a place of health. And that's really the main goal with treatment that we're always trying to do, is just constantly bringing things back to balance. In terms of other modalities that we have at the clinic as well, herbal medicine is another big one. So herbal medicine is something that I learned towards the end of my schooling and then for a few years after graduation on my own, just through various online resources and continuing education classes. But herbal medicine is another great addition. I describe it kind of like acupuncture in a bottle. So obviously, if someone is getting a treatment with acupuncture, they need to come into the clinic every so often to get the results. Whereas with herbal medicine, you can kind of take that bottle of herbs that is tailored to you, and it gives more kind of long-term results outside of the treatment room. So it's a great way to kind of extend the results of treatment that we start here in the clinic. And it's a really easy thing to kind of incorporate into your life. So herbal medicine is something I love. And there are a lot of patients coming in now looking for more natural options. So I think that herbal medicine is another tool that is definitely gaining popularity in not just the city, but I think of the world. I think that Chinese medicine and herbal medicine is really starting to take off as a system of healing too. Is there any other areas that you're curious about?
What is the area of acupuncture that you enjoy doing the most?
So in terms of the area of acupuncture that I enjoy the most and kind of, I think the direction I sort of see my practice headed is in the treatment of mental health. So obviously there's a ton that we can do for the physical body, which I love. And I understand that everything is connected when it comes to physical and mental health, but I really do enjoy helping people move through things like depression, anxiety, even in some cases symptoms of PTSD or trauma, which acupuncture is a helpful tool with. I would never claim that acupuncture is going to be a standalone cure for any serious mental health issues, but it is definitely a powerful tool in helping to manage symptoms, helping to bring the nervous system back to balance, and just helping to promote an overall sense of well-being and calm. It's a tool that I've used myself for many years, on the patient side, and I've noticed a huge improvement in my mental health and my well-being. And I find that if it was the choice between giving up things like acupuncture and herbal medicine or giving up my medication, I would much more quickly get rid of medication, because I find that the herbal and acupuncture side has been much more beneficial to me overall in terms of my just approach to health and my approach to life. So mental health, I think, is a really important focus for practitioners. And I also think it's important that we continue to teach the public, because again, so many people know now, it's pretty common knowledge that you can treat a sore neck or a sore back with needles, but not a lot of people are aware of the fact that there is a deeper side to acupuncture that addresses those more mental health concerns. And being that we live in a world that is getting increasingly stressful, and the amount of patients I have that have been on things like stress leave from work, I think that the opportunity to come into a treatment room, lie down, and just kind of escape for an hour is huge for people. And I know that the idea of sitting with needles in and relaxation isn't something that people always view as being very, it doesn't come to the top of your mind when you're thinking of a relaxing experience. Needles are definitely scary, but I think most of my patients can attest to the fact that it is not a painful process. And once the needles are in, you really are able to relax into this almost trance-like state. And a lot of people report just feeling a sense of bliss and calm, essentially. So I think it's a huge draw for people to be able to just escape their worries for a little bit. It's something I love to do.
That's awesome. Where do you see yourself going with this in the future? Do you see yourself expanding your practice more?
So it's funny. When I first graduated, I had these grandiose ideas of running a really big practice, running multiple treatment rooms. But over the years, I've realized that that's not the style of practice that makes me happy. So I'm not necessarily looking to grow in terms of like numbers. I'm pretty content to just have a full schedule running one room at a time. That's enough for me to pay my bills. It also allows me to focus on my patients one-on-one, because I know there are some clinics that have a different style than mine, but they do run more of like it's very efficient, and it's almost like an assembly line of like pop the needles in, next room, pop the needles in, next room. Whereas I really like to be able to give people my full attention.
That one-on-one interaction.
Exactly.
Nice.
One-on-one interaction is really important to me. And I think my patients value that. I think the people that come to see me enjoy that they are listened to, and that they know that when they book the time that they have me there for the hour. So that way, if we are discussing things maybe that are more heavy or things that are going on in their life, I'm not looking at my watch or tapping my foot. So I think in terms of the future of my practice, I'm more interested in maybe practicing part-time and maybe doing more teaching. So I have taught in the past, but I do really like the idea of targeting my teaching more to just the public. So whether that's live in person, whether that's online, I would love to help people just learn how to navigate the world and their lives through the lens of Chinese medicine. Thinking about, okay, winter's coming up. How can I prepare my body in a way to weather the winter well? So things like that. I definitely see myself being kind of part-time practitioner, part-time teacher. But I do think that Chinese medicine and acupuncture will be part of my life forever. I don't really see myself retiring in the traditional sense. I think I'll be treating patients as long as I'm able to stand and move.
Oh, good for you.
So
that's awesome. At the end of the day, you can still keep your mind active and busy in retirement age, in that age bracket, and still make a living, and helping people really is the biggest thing.
Yeah, I mean, I definitely think I won't be going to the same degree. I won't be full throttle all the way, but yeah, I don't think...
Even it's like, 2 days out of the week, like, okay, I've got my live session with this group, and we're going to be talking about this or that.
Exactly.
Just to keep your mind active, but you're still helping people at the same time.
And that's one of the biggest things, is that I just love how this career and this field keeps my mind fresh, because I'm constantly seeing different cases. I'm thinking about things in new ways. I'm seeing the world, even just basic things like the balance of yin and yang. I keep returning to it year after year and developing a more deep relationship with those theories. And I know that will just continue as long as I live. So I'm excited to kind of hold on to that passion. And I love spreading that passion to others as well. So, I mean, if I could help to recruit more people to this medical world, then that would also be great. I'm not trying to convert anyone, but
that's okay.
But I'm always happy to be a resource if people have questions, and I'm sure we can share my contact info as well. But,
absolutely.
If anyone would like to reach out,
that's right.
I'm happy to share in whatever capacity people need.
For sure. Awesome. Well, John, thank you so much for coming on the Island Girl Tea channel and speaking to the people.
Yes, anytime. If ever you're in need of a more in-depth overview of any other topics, I'm always happy to sit down and chat.
Oh, that's wonderful. Thank you so much. Thank you for my subscribers, family members, friends, coworkers for joining on the video or watching the video here today. I will drop a link below with John's information, or even add it to this video as well later on. You'll be able to contact him somehow, reach out with questions. And John, we wish you all the best in your future endeavors.
Thank you so much.
All right, take good care.